Hey, what's going on, guys? My name's Ray Lynch. I'm here with Aaron Fick. I'm just going to go ahead and introduce myself briefly, and then I'll let Aaron do that for himself. My name is Ray Lynch. Again, I'm a physical therapist, and what Aaron and I kind of wanted to do is in discussions in the past. Him and I have known each other for quite some time, probably 7 or 8 years, going back to when we were both personal trainers at Columbus State University. And we had kind of been talking about different patients and different perceptions and kind of what's been going on in not only the United States, but kind of worldwide as far as pain and health and where physical therapists fit in and strength and conditioning coaches and just kind of trying to make sure from a consumer standpoint, or even if you guys are physical therapy students or professionals yourself in either profession, that it's a little bit more clear on what we can do and when to refer and all that kind of stuff. So again, I'll let Aaron kind of introduce himself and then we'll go from there.
So my name is Aaron. I'm a strength and conditioning specialist by trade. I've been in the realm for about 10 years now and just recently transitioned to the clinical side of the house, dealing a lot more on the less aggressive side of things now, but definitely more trying to get the health promotion across to the patients and clients as well. But the past 10 years has been in the trenches on the gym floor with everyone ranging special forces, D1 athletes to special pops. So that's where I'm coming from.
I gotcha. Yeah, so again, Aaron and I go back. I kind of met him, I guess it was probably 7 years ago or so at Columbus State University. Roughly 7 years ago. And you were already a certified strength and conditioning coach, right?
Mm-hmm.
And
right.
So we were both, he was doing that, and we were both doing personal training, and then I kind of split off, went to physical therapy, and coming back into Columbus, Aaron was here. You're now in North Carolina, right?
Right. The Fort Bragg area.
So he's now in North Carolina. I'm in Columbus, but I think the reason why we started talking is because we were talking about how this perception of when does a coach kind of come in, when can they help, and I think one of the things that I recognize kind of on my own end, and I come from a fitness background on my own end, is man, when do I refer, or when do I know when I'm going to discharge my patients, but who do I refer to, and what are the questions that I need to know, or the material that I need to know in order to know who's best to send them to. So I know Aaron, but Aaron's in North Carolina now. And so this guy that I trusted and could have sent some patients to is in North Carolina. And so I'm like, man, how do I make the decision on where to send this person next? Because, fair or not, what you do with the patient after they're discharged reflects back on you. And having someone professional and knowledgeable in impairments that you may be working with, or maybe surgeries or whatever, I think is really helpful. And so what we wanted to do is kind of start off the conversation with kind of some gold standards in the fitness industry. So this is more for the physical therapy students or physical therapists when you're getting ready to discharge your patient and you're not really sure who to send them to. Aaron, do you mind just telling them maybe some good questions to ask, or certifications? There's so many letter combinations out there, and,
Right.
and I think that it's very confusing even for medical professionals, and can you just kind of enlighten us as to what the gold standards are and what kind of things we should be asking?
Right. So in terms of the technical stuff, the certifications that are the gold standard out there, the two that come to mind are the Certified Strength and Conditioning Specialist from the National Strength and Conditioning Association. This kind of gets automatically associated with sports performance, things like that. That's not necessarily always the case. It's just a performance mindset to whatever population you're pursuing. So, for the athlete, that performance mindset is your typical cliche agility, strength, and power development. But everyone has performance. The geriatric patient has a performance of needing to move better. Bariatric post-surgery, they have performance goals. Everyone has a performance goal based off who they are. So that's kind of the standpoint of the strength and conditioning specialist. And then the second go-to standard would be your ACSM exercise physiologist. That's more the clinical side of the house, a lot more in sync with the medical professions, you'll probably see a lot more of them in the hospital setting, side by side with the doctors, whether that's post-op cardiac side. I mean, there's 1,000 routes that can go there. But also outside of the gold standards in terms of certifications, you need to look at their resume, their history, you know, where they've come from, who they've dealt with on a regular basis. And then after being confident in who they've dealt with, you need to get a good vibe from them in terms of are they staying in their lane? That's a huge thing in the fitness industry. It's the Wild West out there. Everyone likes to put everything out there in terms of what they can work on, what they can fix. And the biggest thing that's going to stand out is if you know a strength and conditioning specialist or exercise physiologist who's confident in what they do and knows what they're doing, they have no issue staying in their lane. You know, they're not trying to overcompensate by reaching out into areas that they don't have business speaking on. So definitely just true to what they do, and very, very professional history in terms of having hands-on client experience.
And I think, and that's kind of one of the things, guys, that, as you know, if this is for the physical therapy students, I think a lot of times, we, in our field, say for instance, you've got, like the OCS, and all these other letters that can come after your name. And in the fitness industry, you've got, CSCS, and there's plenty of other ones as well. And I think, that does have some value. I think it absolutely does, but I think it comes down to the other thing that Aaron said, and that's experience as well. And having that conversation with them. So not just, chalking it up to, well, they have a CSCS, so they must know exactly what they're doing. And that's but that's anybody, you know what I mean? I think that's, right. You've got to have good questions to ask. Even if you're going to see your physical therapist, how many people have you seen with similar things that I'm dealing with? So you come in with, let's just say you had this back surgery and you went to physical therapy afterwards and you've been discharged, and now you're going to see maybe a CSCS or an exercise physiologist or even a personal trainer. The question you should be asking is, have you dealt with my condition before? Right. And get an understanding of if they have or if they haven't. And I think the good ones out there will tell you when they haven't. I mean, it's like in town. So for me, there's a physical therapist in town here in Columbus who's really good at treating patients post-op for like rotator cuff repairs. I mean, that's mostly what he does. It's not just rotator cuff repairs, but he treats patients with shoulder pain, shoulder surgeries 95% of the time. It's not to say that I can't treat that. I mean, if it's, not surgery, I feel 100% comfortable dealing with that. And even with surgery, I do. But I think sometimes as a professional realizing, okay, if I don't feel comfortable with this situation, is there someone else? And don't be afraid to refer to someone else as well. But Aaron, I think the number one thing, I think that's good information, right? So exercise physiologist, guys, he said 2 gold standards. Exercise physiologist or somebody with a CSCS, and then obviously developing that relationship as a healthcare professional with the fitness provider. The other thing I want to know, I think, because sometimes those conversations, you and I have known each other, so those conversations between you and I are not abrasive. But so this is also for maybe the physical therapy student or the physical therapist. How should we approach a fitness professional? What are some? Because I feel like sometimes we're kind of like, do we say this? Do we say that? Or how would you address it if you're coming from our end without being like too abrasive and just being respectful?
Sure. So again, going back to how the fitness industry is the Wild West, and there's not a lot of across the board standardization out there. So you approaching me and asking me very direct questions in terms of, have I dealt with specific issues before? Being direct won't come off as abrasive. And if it does, in terms of when you ask that direct question, if it does come off abrasive to that trainer, that could be your first cue of, okay, that's going back to the whole, are they confident in what they do? Have they been around this industry long enough to understand and know where you're coming from? Because I completely get that when As a medical professional, you're the one in authority. You're the one that takes on this ultimate responsibility. And you have to be direct in asking those questions in terms of, are you qualified to handle what I'm about to give you? Because it does need to be taken seriously. And that's where there's a lot of a lack in the fitness industries. It's viewed more as entertainment now and just kind of, high compliance, and that can lack with the professional approach and understanding that this is still an extension of medicine and it needs to be treated as such.
Yeah, so I saw this graphic, and Aaron and I have discussed this previously, but there's a graphic, and I'll have to see if I can put it in maybe the comment section of this video. And it's essentially about kind of what the spectrum is. So when a patient has pain, they're kind of here, they're starting off here, and as they progress, kind of they're with physical therapy and physical therapists or another medical professional is guiding them, right? But when they're out of pain and they're able to perform movements properly, what's the next step? Is it they just do their rehabilitation exercises for the rest of their life and that's what they have to do? Or is there another step? And I think you posted not too long ago, and it got me really thinking, and it was really good because it was like, okay, I don't remember. You may have said it was like a guy doing these shoulder exercises, and
sure,
you were like,
yep.
Okay, I mean, you have to get past point B so you can move on and still, load these tissues, but load them in an appropriate manner. And guys, that's the piece that I think as physical therapists we're missing. We've, over the last 20 years, as far as back pain goes, we kind of keep everybody on this side of the graph, and we say, okay, well, if you get hurt doing these exercises, then come on back over here and we'll see you again, and then come on back over here and we'll see you again. But we're missing this entire piece, and that entire piece, I think, is really where we need to be better at referring out to someone like Aaron, who is knowledgeable in load management, who is knowledgeable at, okay, what's the risk factors for reoccurrence of injury? What are if I load by this much percentage from week to week, if I go up by this much, am I going to injure him? They know this stuff, guys, and this is where the conversation has to happen, I think, Aaron, between medical professionals and strength coaches, and develop these relationships. And I think as you feel more comfortable with the individual, you'll feel more comfortable giving them maybe your clients when you're done with them, and feel more comfortable that they're handled appropriately. I think, Aaron, it's funny because I'm kind of studying for my specialist exam right now, and in there, actually, one of the test questions, like in the back of the book, I mean, whoever has access to this has access. It's nothing classified. But in the back of the book, it's basically like this person's fearful, and they don't want to move. They have low back pain, and what do you teach them? And it's like, talking about reoccurrence rates and things like that. But the other thing that it says is, look, guys, if they are lifting appropriately and progressing load appropriately, they're not at an increased risk for injury.
Right.
And I think that's where I think a lot of people, and I've even heard it said, so I had this guy, 30 years old, and he comes into my clinic, he's military, and he basically says, well, I can't lift because basically my back's just going to go out. I'm like, it's going to go where? And he's like, it's going to go out. It's just going to, do this and do that, or my back's going to give out or whatever. And if I load, and it was funny because I was like, well, what are you loading it with? And he's like, man, if I deadlift 315, like, that's when I feel it. I was like, that's a lot of weight, man. That's pretty good. And he kind of smiled, and I was like, dude, honestly, like, it shouldn't all be about like, well, how much weight can you lift? But man, I was like, that's pretty good. And I said, you just need to be lifting properly. And I said, are you lifting properly? Are you also managing the load, right? So you don't just go from, if I've never bench pressed, go from benching 135 pounds to, I'm feeling good, so I'm just going to go ahead and throw 205.
Exactly it.
Even if my form at 135 looks great, I don't just throw on that weight. So can you talk a little bit about what you guys know from a load management standpoint, what you tell clients, or I just kind of leave it to you and leave it open-ended and let you just kind of discuss that aspect?
Yeah, so, I mean, when we talk about load management, it's the whole purpose. I mean, from rehabilitation, as complex as that can be, to me, the ultimate underlying goal is to create an adaptation in the body to positively influence it and progress away from that injury. That mindset doesn't change post rehabilitation, and the only way to continue adaptation is to have an appropriate stressor from which the body can adapt to, right? Too little stress, and there's not going to be any adaptation on the body, right? That's why we have to progress to larger, more stimulating exercises. However, the opposite spectrum, too much load, and the body won't be able to overcompensate from, and too much load too chronically is what's going to lead to an injury. You know, somebody says, "Oh, I busted my knee on a bad squat that day," and then they'll blame it on the squat, and that's a very reductionist mindset that day your knee hurt on that squat. Well, that knee pain could have been 6 weeks in the making from your grinding efforts developed upon itself, and the complexities to internal load and external load. So it can be a lot deeper sometimes than just blaming it on one incident. And so I say that all to understand that if we're not tracking the stimulus that we're placing on your body, then you have no idea how your body's going to respond. If one day you're doing 80%, and the next day you're doing 100%, and then the day before or the day after that you're doing 60%, but a mass amount of influx in load or in volume. I mean, it's all over the place. There's no acute chronic load adaptation. And so when we get away from small titrations and small adjustments, I mean, when we put it in light like that, I mean, it's completely obvious that you're prone to injury. I mean, it's just as wild as bad form. And, we see that all the time. You can have great form and still get hurt. And you see people with bad form and they're not getting hurt, but it's a process coming. So, it's a much deeper, much more complex issue when you bring up load management on top of form, right? Form is extremely important, but we can't reduce everything to just a simple form. So it's a very complex issue, and my role in that is the prevention of that through appropriate loading. I mean, it's very calculated. It's very complex on my end, right?
Yeah.
But when it's displayed to the client and the patient, it doesn't look like much. It's high compliance. It's just straightforward. I don't need to show this complexity to them. I just need them to do what's
on paper. Yeah.
Right. What's planned for them. So, and I think that's another area where there's a lot of chaos. Is a strength coach who tries to show off, his fancy, insane program with this implementation and this implementation, and then all these big $5 words, and then you come down to it, and there's not even the basic premise of load management and tracking titrations and things like that. You don't. Again, it comes with the level of confidence as a coach that you don't need to show off the complexity. You need to internalize that and make it applicable and straightforward for the patient, so that has that high execution rate. Because no matter how good the program, if it's not compliant, if it's not straightforward, it's what's it matter?
So guys, one of the things that Aaron does, you kind of do some online coaching and tracking and things like that, right? So,
right.
And he'll kind of post every once in a while and show these like tables. Like what he does is he goes into it and looks at it and calculates volume and calculates what they should be doing. And they also, and correct me if I'm wrong, but as a CSCS, as a part of that certification, it's looking at load management, and so this is what he does really well. Aaron does this better than I do. I mean, I'm not going to pretend, right? So on this end of the spectrum, I'm pretty good. But, man, when it's done with that, like load management and volume management and intensity and all of that, and progressing from there, and I think that's really his bread and butter. But one of the things that they are really good at and Aaron's really good at is looking at, well, what's the risk? What's the risk percentage, right? So if I increase by 10% this week in volume, what am I dealing with, right? What if I go by 20% or 25? I mean, there are tables that literally have for specific, percentages that literally show, okay, what's the risk factor? So Aaron, as a coach, actually looks at this and looks at people's, volumes and everything they're tracking. And I think that's great. I think that's one thing, guys, if you find a coach that does that and takes the time to break it down like that, and that could even be a question like, are you tracking what your clients are doing. Because there's many gyms out there, just like you said, where it's more about creativity than safety or about load management. And I think really it is. It's $5 words and people trying to sell a product, and it's business. I get it, and sometimes it's more about quantity than quality. And I think everyone goes in with good intentions,
Sure.
but I think anytime you introduce, money into the aspect, right? Good intentions or not, you are like, man, I want to help more people. And sometimes the helping more people is you hear this, well, man, I'd really love to do this or whatever. Or I've heard that if you do the same thing over and over again, then you're just not going to trick your body or whatever. And that's really kind of the thing out there right now, guys, is, well, let's trick our body every day. And that goes back to Aaron's point of, well, one day you're doing 80%, then 100, and then 50. And so the question you really need to be asking is, how are you guys loading or tracking load in your clients? And if they say we're not, or they give you a blank stare, that should be a red flag. I mean, talk to several professionals. But I mean, if I talk to Aaron says, well, I track every single client. I've got this paper from this week and this paper from this week. And my clients send me videos and I watch their form and I give them feedback. I mean, that's what you were looking for. Guys, let's just say for low back pain, neck pain, anything over the last 20 years, as physical therapists, we individually have not been the answer, regardless of, is there more research coming out? Absolutely. I think we have something valuable to bring, but I think we also have to understand the spectrum, and we have to understand what's next for our clients. And that's exactly what Aaron and I over the next couple of weeks really want to be bringing to you is how do we move patients along the spectrum? How do we pick the right professionals to work with? And how do we help our patients and clients get better over the long term? Because low back pain and things like that just hasn't changed. And we've got to take a new approach. And I think, when it comes to fitness, fitness, exercise, as long as it's done right, I think is highly beneficial for multiple systems, from a psychological standpoint even, and from a pain management and really injury risk reduction as well. There's an inherent risk with exercise, obviously, but I think we could all agree that a little bit of knee pain here or there, if they learn how to load, appropriately after that, a little bit of knee pain here or there, I think is okay if we understand all these benefits as well, right? So heart and lungs and social and all these other things that go into it, we can help along the way and make sure that they're loading appropriately and keeping from injury. But I guess inherently, Aaron, it's going to happen every once in a while. But
sure.
Having the right network and having the right system in place, I think, is really important. So, well, look, man, what I think would be really good is you just, the next couple of weeks, we just kind of get together and talk, and you guys will be taking comments from you. Feel free to put something down in the bottom in the comment section and tell us what you would like us to discuss. We've got several topics. Aaron and I could literally go on and on all day about imaging and pain and all this other stuff. So we've got plenty of material, but we want to make sure that you guys are getting your questions answered. Again, my name's Ray Lynch. If you want to reach out to me through email, if you're not comfortable doing it in the comments, just reach out to me at rlynchdpt@gmail.com. And Aaron, if you want to give your contact information, feel free to as well. But yeah, man, I've enjoyed it.
Yeah, it's been great. I definitely think we need to stay on top of this and gather some questions and go into details on what's out there. And if there's not many questions at first, like you said, we got plenty of content to cover and hopefully get the wheels turning, because sometimes people won't even know what to ask until you get that wheel turning and bring new perceptions and new viewpoints to light. So
absolutely. Well, I appreciate it, man. I'm gonna go ahead and we'll stop recording, and then you and I can kind of hang out for a minute afterwards and go from there.
Sounds good.
I appreciate it, guys.